this effort in the European Parliament side by all of you last year, because this is a plan for all Europeans, and you are there, the representatives of all European citizens. I truly wish that if we didn't have the COVID pandemic, we could have been there today with a similar event like last year, to be able to bring everyone together with your committee in order to share the plan and the announcement of the plan. But we will have opportunities to do this in the future, I am sure, because this plan is the beginning of a journey, and we have a great deal of work to do, as you know. The European Parliament has played a very important part in this journey from the very first day, and as your committee has. And many of you know that, having been through cancer myself, I want to thank you for really embracing the vision of what we are trying to achieve for all, not only cancer patients and their families, but for all citizens of Europe, because as we will see in the few words that I will say, one of the big pillars in our plan is about prevention. I know that this committee will be an important partner in the implementation. We spent 12 months of consultations, of listening, and I would say learning as well, before we were able to reach Europe's Beating Cancer Plan. As you know very well, all of you, cancer is a growing challenge in Europe, and we need to have bold and decisive actions in order to be able to really make an impact. And I believe firmly that this plan will be a game changer, which will benefit all citizens and stakeholders and health systems in very concrete ways. And it will also help our member states turn the tide against cancer. The plan addresses cancer in a holistic way, through 4 pillars: prevention, early detection, diagnosis and treatment, and the quality of life for cancer patients and survivors, because there are many issues here. I wanted to share with you the way we worked for this plan, because I think it gives the importance. And I want to say here that under the leadership of Vice President Hinas, there was a committee, a working group of 13 commissioners, at least 13 commissioners working in this plan. And this is because it really is a holistic approach to dealing with cancer. Research and innovation and personalized medicine will be the starting approach for cancer care in Europe. And we will be addressing the reduction of inequalities. The first pillar is on prevention. We aim to prevent the preventable. We will be addressing key risk factors such as smoking, such as harmful alcohol consumption, such as obesity, lack of physical activity. And it includes ambitious but also necessary goals. We want to eliminate the cancers by the human papillomaviruses, and we're proposing EU support for member states on vaccination, so that they are able to vaccinate at least 90% of an EU target population of girls, and increase the significant amount of boys being vaccinated by 2030. The second pillar looks at early detection of cancer, which we know saves lives and gives people the best chance of beating cancer. And digital tools here will play a huge role. We will develop a new EU cancer screening scheme to ensure that by 2025, 90% of the target population of Europe is offered breast, cervical and colorectal cancer screening, but not only offered access to this, that they are offered access to to screening that meets guidelines by 2025. The third pillar is on treatment, and we will be ensuring better integrated and more comprehensive cancer care, and we will address the current unequal access to quality care and medicines. We will be setting up a new EU network of recognized comprehensive cancer centers in every member state to improve access to high-quality diagnosis and care. This is extremely important. This is not about building new buildings, but about linking up centers of excellence so that patients have access to multidisciplinary teams and to centers where they can have really access to the best care, no matter where they live in the EU. And we will be setting up a cancer diagnostic and treatment for all initiative, which will improve diagnostic and therapeutic approaches. So Europe's Beating Cancer Plan aims not only to ensure prevention, it aims at early diagnosis, and it aims at treatment. But we cannot ignore, and there is good news in that with the current treatments and science, we have many people who have survived cancer living among us. And we need to ensure that patients not only survive their illness, but they also live long, active and fulfilling lives, free from discrimination and from other obstacles. And with this goal in mind, we have the fourth pillar, which looks at survivorship issues, rehabilitation, emotional distress, potential tumor recurrence and metastatic disease. For many in this call, we all know about the wonderful initiative of the right to be forgotten, and we are looking at many of the actions of how we can exactly push forward with patients' rights or survivorship rights in this area. It includes other important actions, fair access to financial services, which having had a history of cancer, one should be able to let science speak and have fair access to financial services, and also reintegration of the work into the workplace. And by 2023, we will be launching the Better Life for Cancer Patients initiative, which includes what we call a Cancer Survivors Smart Card. And this will be a card that will give access to cancer patients for all that they need to know if they have gone through cancer. And we will be creating a virtual European Cancer Patient Digital Center to support the exchange of patients' data and monitor their condition. Last but not least, we specifically address pediatric cancers in our plan. These cancers need to have a special focus, both in terms of the early diagnosis, the treatment, the access to medicines, and survivorship issues. And this is important that we highlight the group of children and adolescents and place the spotlight on them as well. Ladies and gentlemen, the COVID-19 has reminded us that cancer is not only, that health is not only the responsibility of the health sector, and that good public health and strong health systems are important, and the genuine health in all policies approach. And this is certainly true of cancer prevention and care. And this is why we will be working in many policy areas, such as employment and energy, research, agriculture, transport, marketing, taxation, and climate. Everybody is working together in order for us to implement this plan. And the cancer plan will be working also closely together with the pharmaceutical strategy that we announced in November to address the challenges of access, of availability, and affordability of medicines. So I want to just end with 2 points. The first of all, we will be financing this plan through the EU for Health programme and other EU instruments with a support of up to €4 billion to member states to help them build up health systems and reduce the suffering caused by cancer. And we will be also, we have set into place an implementation working group to be able to follow up continuously. And this is why I said the journey starts now, how we move forward with implementing the many targeted actions in our plans. So this is an ongoing plan, a plan that it is now beginning its journey. It depends on good work and collaboration from everyone, all the key stakeholders, all member states, and of course the European Parliament. I look very much forward to working with you continuously, and thank you for your unwavering support on this journey. Thank you.